The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. This week's episode is titled A Modest Election Year Proposal for Healthcare Reform. Before we begin, I want to tell you a little bit about today's episode. Back in 2024, as the presidential election was heating up, I recorded and wrote a blog and podcast series outlining what I believed was a realistic roadmap for healthcare reform in America. I wasn't interested in partisan talking points. I wasn't trying to score political points for Republicans or Democrats. I was simply trying to answer one question. If we could redesign American healthcare from the ground up, what would it actually look like? Now, here we are in 2026. The midterm elections are approaching. Affordability and especially healthcare costs remains one of the top concerns among voters. And remarkably, I've found that very little needed to change from what I wrote and broadcast 2 years ago to bring this new podcast and blog series to you today. If anything, the urgency has increased. Families are paying more, employers are paying more, federal and state governments are paying more. Yet Americans still struggle to obtain affordable health care. That tells me our problem isn't temporary. It's structural. Over the next 5 weeks, unless some earth-shattering developments occur that would need me to cover any other topic, I'm going to walk you through what I believe is a uniquely American blueprint for healthcare reform. This isn't Medicare for all. It isn't simply preserving the status quo. It isn't government takeover. It isn't deregulation. It's something different. It's a proposal that borrows from what works, from America and from the rest of the developed world, while rejecting the ideological extremes that have prevented meaningful reform for decades. If you'd like to follow along, I've also written 4 companion articles on the Healthcare Labyrinth blog at my website, https://healthcarelabyrinth.com. They were published on May 26th, May 28th, June 4, and June 12th. Many of these ideas also come from my book, The Healthcare Labyrinth, available in print, ebook, and audiobook formats at my website and from leading booksellers. We'll take our usual 3 breaks. So let's take that first break, and when we come back, we'll talk a little more on the healthcare crisis we face. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you are enjoying this episode of the Healthcare Labyrinth Podcast. My name is Marc Ryan. We're talking all things healthcare reform. I promised in this introductory part of our Healthcare Reform podcast series to sketch out my proposal and what you will be hearing in these episodes coming up. So part 1, why this election matters. The 2026 midterms are shaping up to be another referendum on affordability. Inflation has moderated compared to its peak, but healthcare inflation hasn't disappeared. Employer premiums continue to rise, deductibles continue to rise, co-insurance continues to rise. Millions of Americans have insurance cards in their wallets, but hesitate to use them because they simply can't afford the out-of-pocket costs. And for many exchange enrollees, the expiration of the enhanced COVID-era premium enhancement subsidies has created another affordability shock. Millions face higher premiums, and many may ultimately lose coverage. Healthcare has become something people increasingly fear, not because they don't value it, but because they fear the bill that comes afterward. That should concern Republicans, that concern Democrats, it should concern every American. Part two, the time has come for a grand bargain. I've spent decades working in healthcare. I've worked inside government. I've worked inside private healthcare organizations. I've worked with health plans. I've worked with providers and hospitals. If there's one lesson I've learned, it's this. Neither political party possesses all the answers. Republicans correctly point out that markets encourage innovation and competition. Democrats correctly point out that healthcare isn't like buying a television or a car. It's not a commodity. Healthcare is different. When someone suffers a heart attack, they don't shop. When someone is diagnosed with cancer, they don't comparison shop either. When your child breaks an arm, you don't negotiate prices before heading to the emergency room. Healthcare requires markets, but it also requires rules. The question isn't government versus private enterprise. The question is, how do we get both working together? That's where my proposal begins. Part three, America doesn't really have a healthcare system. That may sound strange, but hear me out. Most developed countries adopted one coherent model. Some chose socialized medicine. Some chose single-payer healthcare. Others chose private systems with affordable universal access. America chose, ding, 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 all of the above. We have employer coverage, which is private coverage. We have Medicare fee-for-service, which is single payer. We have the Veterans Administration healthcare facilities and the Indian Health Service, which are socialized medicine. We have Medicare managed care, children's health care, Medicare Advantage, and the exchanges, which is where government funds and oversees the systems, but private entities manage and deliver care. We have all sorts of private offerings and products for individuals, from exchange compliant to short-term insurance and more. In essence, we have dozens of offerings in our healthcare system, each with different rules, different payment systems, different benefit structures, different administrative requirements, different prices, different incentives. It's incredibly fragmented, and fragmentation costs money, a tremendous amount of money. Part four, the numbers are stunning. Let's step back for a minute. In 2024, America spent approximately $5.3 trillion on healthcare. That's roughly 17.2% of our gross domestic product. Comparable developed nations spend closer to 11%. Think about it. If America merely approached the average spending of our peer nations, we could free up roughly $1.8 trillion in spending every year. That's not a rounding error. That's an economic transformation. Imagine what families could do with lower premiums. Imagine what employers could invest in. Imagine what governments could do with those savings. Healthcare isn't just a healthcare issue. It's an economic one, too. It's a competitiveness one. It's a national security issue as well. Part five, but don't we have better care? This is one of the biggest misconceptions. Americans often believe we spend more because we receive dramatically better care. In certain specialized areas, that's true. We lead in medical innovation. We develop groundbreaking drugs. We have incredible academic medical centers. We excel at treating complex disease. But when you measure overall outcomes, life expectancy, preventable deaths, infant mortality, maternal mortality, chronic disease, the United States consistently ranks near or at the bottom among developed nations. That's unacceptable, especially considering we're paying almost twice as much. I too always tell people that if you have wealth and means or a gold-plated health plan, there is nowhere you would rather get treatment than in the good old US of A. But sadly, most people do not meet that profile. Sadly, more and more Americans increasingly have deficient insurance that they cannot afford to use, or no insurance at all. So they suffer from navigating the most expensive healthcare system in the world and get so little from it in terms of health. Part six, the good news. Here's where I become optimistic. This isn't an impossible problem. We already know what works. We've simply failed to connect the dots. After studying healthcare systems around the world and working inside our own, I believe meaningful reform rests on three simple pillars. First, reform prices. Second, stop obsessing over utilization management and invest in primary care and care management instead. Third, ensure affordable universal access through a uniquely American private delivery system. That's it. Three pillars, simple to describe, admittedly much harder to implement, but it is entirely achievable. Let's dive a bit into these pillars. My next 4 podcasts will go deep into the 3 pillars, and the final episode in the series will sum up with what I think could be a grand healthcare bargain if politicians had the courage to come to one. With that, let's take our second break, and when we come back, I will sketch out the entire series for you. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We hope you are enjoying this episode of the Healthcare Labyrinth Podcast. My name is Marc Ryan. We're talking all things healthcare reform. I promised in this introductory part of our Healthcare Reform podcast series to sketch out my proposal and what you will be hearing in the coming episodes. Part 7, Pillar 1, Price Reform. Healthcare prices in America make little sense. The same MRI can cost $500 at one facility and $5,000 at another. The same surgery may cost 3 or 4 times more depending on the hospital. Employers routinely pay several times what Medicare pays. Consumers rarely know prices beforehand. No functioning market can operate this way. We'll spend our next episode discussing how uniform pricing, site-neutral payments, transparency, drug reform, and value-based payment could dramatically reduce costs while preserving innovation. Price reform alone could save hundreds of billions of dollars annually. Again, this is the conversation we will have in episode 2 of the series. Part 8, Pillar 2, Stop managing claims and start managing health. America has become obsessed with prior authorization. We spend enormous resources deciding whether care should occur. Meanwhile, we underinvest in preventing disease from developing in the first place. Imagine if we redirected even a fraction of those administrative resources toward primary care, toward nutrition, toward prevention, toward behavioral health, toward identifying social determinants of health, toward helping diabetics stay healthy, toward preventing heart failure, toward avoiding hospitalizations altogether. That's the conversation we'll have in episode 3 of the series. Part 9, Pillar 3, Affordable Universal Access. Finally, coverage. Let's acknowledge reality. Employer-sponsored insurance works reasonably well for many Americans. I'm not interested in blowing it up, but millions of Americans lack a stable connection to employer coverage. Some move in and out of jobs. Some work part-time. Some are self-employed. Some simply cannot afford premiums and deductibles. That doesn't mean we need Medicare for all or British socialized medicine, nor does it mean we should accept today's fragmented safety net. Instead, I propose creating a modern, affordable, privately delivered safety net program that fills the gaps while preserving employer coverage. Each would benefit from lower costs through the price reform we talked about. We'll explore this in episode 4 of our series. With that, we'll take our last break, and when we come back, we will allude a bit to the possible grand bargain I will feature in the series. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back. We hope you are enjoying this episode of the Healthcare Labyrinth Podcast. My name is Marc Ryan. We're talking all things healthcare reform. I promised in this introductory part of our healthcare reform series to sketch out my proposal and what you will be hearing in the next several episodes. Let's turn a bit more to the grand bargain in this part 10. Why Republicans should care. Republicans often focus on competitiveness. Healthcare is one of the largest expenses American employers face. Reducing healthcare costs isn't simply social policy, it's economic policy as well. Lower healthcare costs strengthen American businesses, improve wages, encourage hiring, increase global competitiveness. That's a conservative argument. Why Democrats should care. Democrats rightly emphasize access and affordability. My proposal addresses both, but it also insists on accountability. Universal access doesn't require abandoning markets. It requires making markets work better. Those aren't contradictory goals. They're complementary. But both parties need the courage to compromise. Here's the difficult part. Neither party gets everything it wants. Republicans would have to acknowledge that affordable healthcare access is a national responsibility. Democrats would have to acknowledge that private delivery and market incentives remain powerful tools. That's called compromise. Unfortunately, compromise has become a dirty word in Washington. It shouldn't be. The greatest reforms in American history were built through compromise. Healthcare reform will be no different. Looking ahead, over the next 3 episodes, 2 through 4, we're going to dig deeply into each of these pillars. We'll discuss prices, we'll discuss primary care, we'll discuss affordable universal access. And at the end of the series, episode 5, I'll explain why I believe this represents a genuine grand bargain, one that gives Republicans, Democrats, employers, providers, insurers, and most importantly, patients something worth supporting. Because despite everything we hear in politics, I remain optimistic. America has the resources. America has the talent. America has the innovation. What we've lacked is the willingness to rethink the system from first principles. I believe that can change. That's it for today's episode of the Healthcare Labyrinth Podcast. Thanks for listening. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.